So this is the paper we're going to talk about. The Food and Chemical Safety Committee of ILSI North America, in discussions with some stakeholder groups, saw a need to develop an evaluation of when you should and when you shouldn't use TTC in the evaluation of food contaminants. So I'd like you to think about this in one of two perspectives. One, you're at a food company, you've got a contaminant in foods you've discovered, and you're trying to figure out whether you can use TTC to help inform your decisions. The second perspective is you're a skeptic of TTC. You think it's a get-out-of-jail-free card, and you'd like for some sort of evaluation of how to use it, when to use it, to try to sort of exercise that skepticism. So try to take those two perspectives, please. So TTC, I'm going to go through these next few slides very quickly because you've heard about it in a lot more detail. This is sort of the intro, Psych 101 entry-level course versus the graduate level courses you've just gone through for TTC. But basically, you take information about chemicals generally, broadly, you apply it to your current decision context, you try to make decisions that are informed on that knowledge of other chemicals, knowledge of their biological interactions, knowledge of their chemical structure. You do this in a way of looking forward to new chemicals and how that might inform your decisions about those new chemicals. For example, the contaminant in the food supply that you've just, or your food product that you've just identified. So there's a lot of places where you might apply this. In fact, in the now final EFSA guidance, they list a number of situations where TTC might be applicable, might be useful. Impurities, metabolites, degradation, trace contaminants in foods, for example, the context that I've asked you to think about as one of the two perspectives. But an important concept, and one of the things that I'll hammer home throughout this talk, is that TTC fits within a context of other risk management considerations. TTC is one of the things that you might use to help inform decisions. It's not the first thing, perhaps, that you go to, although looking through a structured decision approach that involves TTC makes some sense. You'll look at established levels, intake levels from other regulatory risk management approaches. You'll look at HACCP. You'll look at good manufacturing practices. Those are the things that help make the decisions in 99% of the cases. You're looking at one of the cases where you might be able to apply TTC. So for example, you must have enough information to apply TTC. You must have enough information initially to decide whether you can apply a particular TTC framework to help make a decision. And many of the TTC approaches, in fact, exclude particular categories or types of chemicals that you might be able to use. So you need to initially consider the context, of how to use the approach in order to decide whether to use it. It's not just something you turn to as a way, again, as a get-out-of-jail-free card. So there's three main categories, and I'm going to go through this in a decision sequence that's in the paper, and I have copies of the paper if you'd like to use it. There's three general categories of how you would use the approach, or rather how you would not use the approach in making a decision. First is if you have other control measures, risk management control measures, such as HACCP or GMP, where you would have already made a decision about this particular material, either as a general class or a particular class within those approaches. Another out of using TTC, a condition where you would not use TTC, is when you have exclusion categories. So in other words, the comparator set that you use to develop your information about the chemistry and the biological interactions for those for that material, or to develop the TTC framework, doesn't cover that particular material. And the third category, and perhaps this is not readily apparent, is when there's an actual MRL, when there's an actual toxicity value derived by a competent authority that you would use instead of the TTC value. These may seem obvious to you in some senses, but when you're approaching this new chemical and you're thinking, okay, what do I do about this material? Going through this decision sequence may help you frame the questions and help you understand when you can use TTC to help support decisions. So another concept that I think is really essential and something that's important in conveying to stakeholder groups or anybody looking at the use of a TTC framework, as everyone before me has pointed out very clearly, TTC is an expert-driven process. It's not a process where I can just pick up the paper, plug in a few numbers, and do an evaluation on my own. It's a situation where you actually need expert input, even at the case of trying to decide whether your particular chemical fits into a particular TTC framework. You need to be able to decide whether to use the framework, and you need to have the expert systems both to do the analysis and also convey the information about the analysis to those who are making the actual risk management decisions. So again, it's not something that you just plug and chug. It's something that you use to inform decisions. And I think that came across particularly well in the talk that Sean just gave, where the expert panels that were evaluating flavors were actually using the information as a way of reflecting on the data and informing their decisions rather than as a determinative step in the process. So within the paper, there's this decision framework. I'm going to go through this pretty quickly through subsequent slides. I'm going to go through each of these boxes. Basically, consider yourself you've got a chemical in a food in your production line. You're trying to figure out what to do about it. What's the process you would go through? So the first thing you might do is, or the first thing you should do, is just collect information about the material, collect information about the relative exposure, collect information about metabolism, about endogenous nature of the material within the body, for example, as Sean was saying. Generally speaking, at this stage of analysis, if the material is somewhere in the 1 to 2 part per million range in concentration, it's pretty likely TTC is not going to work. It's pretty likely that these approaches are going to kick it out. You're going to need to do a full assessment anyway. The second stage is again, collect information about metabolism, mutagenicity, genotoxicity, things like that, persistence, and that kind of information, because these are both going to be used within the TTC frameworks that you are going to be using, and they're also going to inform your decisions even at that stage. If something is incredibly persistent, PFOS, PFOA, things like that, I mean, you're probably not going to be able to use them in a TTC framework pretty much quickly, and so it's going to inform the decision. The second step is look through the existing plans that are available for the risk management of materials like that or that particular material. If it's excluded, or rather if it should have been covered in a HACCP plan, you can't use TTC. If it's included in a good manufacturing practice or through guidance related to that, basically TTC doesn't apply. I think one of the perceptions by the stakeholder groups, by outside communities, is that TTC is a way to avoid HACCP, a way to avoid good manufacturing, a way to avoid using reference doses or maximum residue levels and so on. But TTC doesn't get you to the point of excusing GMP failure. In fact, if you have GMP failure, you've got big problems. TTC is not going to get you out of that. So the second step, rather another consideration in evaluating whether you would want to use TTC is whether it's part of an excluded group. Basically, this addresses the question of whether the learning set of the TTC framework that you're considering using, Cruz et al., some of the publications that are more recent with regard to TTC frameworks, for example, whether their training sets had chemical categories, descriptors that are similar to the compound that you're considering in your particular risk management decision or risk support decision. At that step, there's a lot of categories that other particular TTC frameworks have excluded. Persistent chemicals were mentioned earlier. Things with a high structure, or rather structural alerts for activity, dioxins, engineered nanomaterials were mentioned earlier. Things that we just don't have information in the training sets that allow us to use TTC frameworks. Each of these TTC frameworks lists these things in order to identify when use is appropriate and when it's not. You've already seen that. So, and again, at this stage of the analysis, you would probably already have become aware of the fact that there are existing regulatory values for the particular chemical in mind. If that is the case, or if there's sufficient information, frankly, to develop safe levels or reasonably virtual safe doses for the chemical, then it's probably not a situation where you want to particularly use TTC. And so at this stage of the analysis, collecting information that allows you to come to a determination of whether there is a safe dose, whether there's enough information, whether a chronic bioassay exists, for example, it would allow you to make a decision about whether TTC is appropriate for your particular determination. So I'm just going to run through 4 quick examples to give you a sense of this, just as a way of helping you understand how it is used and how in some cases it gets kicked out. So think if you have a contaminant permethrin in coffee. So coffee beans arrive at your processing facility with 80 parts per billion in permethrin. You're wondering what to do. Should I do anything? You know, those of you who know what permethrin is, you already know the answer to this through the end of this, but we know that it's a pesticide used to control pests. Records show that GMP nor good agricultural practice were excluded, or rather violated, using by us finding this material in our foods. It's not included in the HACCP plan for that particular facility. Experts determine that the permethrin is not in an excluded group. Okay, so you've used an expert panel. They say that it's actually included in the TTC, but actually there's an MRL for this. So that kicks you out. You can't use TTC. Okay. So imagine that you have a lubricant in a pharmaceutical process for creating pills in a food additive process, for example. You identify through structure evaluations that it's a particular kind of contaminant, and it's at 40 part per billion. Contamination is traced to a particular failure in machinery. I've seen this in particular examples. You identify particular components of that lubricant that are a possible contaminant and are rather a possible cause of toxicity. No GMP participation. It's not in an expert group. There's no guidance values, limited specific toxicity data. There's not enough information to actually derive a no AL, a low AL, and so on. In this case, TTC is probably applicable. You can use TTC in this case to help inform further decisions about data generation, about virtual safe doses, about particular risk management approaches you might use in order to understand exposures and reduce them or not. Considering particular contaminants in the seafood supply, similarly going through, if you find through that evaluation that this particular contaminant, BDE for example, is highly persistent, it would kick it out of your evaluation. In that case, you would not be able to use the TTC framework because, as Penny was pointing out, for persistent compounds, the actual dose over time is much higher than you would actually consider in most of these TTC frameworks. And so this doesn't mean, and I want to take a little side note here, that you couldn't develop a TTC framework that does consider persistence. You could. It's just the current TTC frameworks don't evaluate biopersistence as a class of evaluation within their frameworks, and so they currently cannot be used. Fungal metabolite within foods, dry soup mix, 20 parts per trillion, well below the 1 or 2 part per million level that we considered an easy out. You identify a contaminant within that. Again, it's not an excluded category. No guidance values are found. In this case, again, you can use TTC. So what I'm trying to say is that there are cases where you can use TTC if you go through these other pathways and try to identify whether there's information to already make that decision. Okay. That's all I wanted to say. I think there are advances, as have been talked about in prior talks, that will allow the inclusion of a lot of these excluded categories. So the general framework of using TTC will be expanded and will address other things. I think it will go to metals. I think it will go to nanomaterials. I think it will go to a lot of different materials out there. However, it's really important throughout the entire process that you consider that this is an expert process and that it's something that informs risk management, doesn't make determinations about safety particularly. So thanks very much. I appreciate your time. If you have any questions, I'd be happy to answer.